Welcome to this detailed surgical walkthrough of a laparoscopic myomectomy, performed on a 31-year-old female with multiple uterine fibroids and a left ovarian cyst. The patient presented with lower abdominal pressure, menorrhagia, and dysmenorrhea persisting for months. Ultrasound imaging confirmed the presence of multiple fibroids and an ovarian cyst on the left side. To provide an effective and minimally invasive solution, she was offered a laparoscopic myomectomy, a procedure that has revolutionized gynecological surgeries by offering faster recovery, minimal scarring, and reduced postoperative discomfort compared to traditional open surgery. Laparoscopic surgery is now the preferred choice for most gynecological procedures due to its numerous benefits. Unlike open surgery, which requires a large incision, laparoscopy uses tiny keyhole incisions, through which a thin rod-like instrument equipped with a camera and surgical tools is inserted into the abdominal cavity. This allows for superior visualization of internal structures, enhanced surgical precision, and significantly reduced blood loss. Additionally, most patients recover within 12 hours, making this a highly advantageous approach. Here, you can see the laparoscopic view inside the abdominal cavity. Various anatomical structures are clearly visible, including the uterus, fallopian tubes, ovaries, bowel, and omentum. This excellent visibility is achieved by inflating the abdomen with carbon dioxide gas, a standard and safe procedure that provides ample working space for the surgeon. Looking at the uterus, multiple fibroids of varying sizes can be observed. These fibroids are responsible for the patient's pressure symptoms and excessive menstrual bleeding. Uterine fibroids are benign tumors that originate from the muscular layer of the uterus. They are classified into different types, such as pedunculated, subserosal, submucosal, and intramural fibroids. In this case, the patient has multiple fibroids, and complete removal is essential to prevent recurrence. The first step of the surgery involves injecting adrenaline into the uterus. This minimizes bleeding by constricting blood vessels and ensures a clearer surgical field. Next, a wedge-shaped incision is made over the fibroid using a cauterization technique, which seals small blood vessels and prevents excessive bleeding. As the incision is made, the fibroid becomes clearly visible. These well-defined fibroid masses can be carefully separated from the surrounding uterine tissue. Here, we can see a second fibroid being removed in the same manner, demonstrating the efficiency of the laparoscopic approach. Compared to open surgery, which often results in significant blood loss, this technique maintains a clean and controlled environment. Once detached, the fibroids are temporarily left inside the abdomen until the morcellation process, which involves cutting them into smaller pieces for extraction. After fibroid removal, meticulous suturing of the uterine incision is performed using absorbable sutures. Precision in suturing is critical, especially for women who wish to conceive in the future. A strong uterine wall is essential for a healthy pregnancy, making surgical expertise a key factor in this procedure. Here, Dr. Sampath Gnanarathne is skillfully closing the incision, ensuring optimal healing and structural integrity of the uterus. As the surgery progresses, additional fibroids are removed using the same method. When minor bleeding occurs, another dose of adrenaline is administered to maintain a clear field. Each fibroid is excised with patience and precision, ensuring complete removal to prevent recurrence. Once all fibroids have been extracted, the next step is morcellation. A specialized instrument called a morcellator is used to break down the fibroid masses into smaller pieces and extract them through the small incisions. This step requires thorough execution to ensure no fibroid tissue remains in the abdominal cavity. After removal, the abdominal cavity is irrigated with saline to cleanse the surgical site and remove any residual tissue or blood. The final laparoscopic view shows a significant reduction in uterine size, highlighting the effectiveness of the procedure. Following the surgery, the patient experienced complete resolution of her symptoms. The lower abdominal pressure, menorrhagia, and dysmenorrhea were alleviated, and recovery was swift. With only a few tiny incisions that heal rapidly, patients can resume their normal activities in a short period with minimal discomfort. Laparoscopic myomectomy represents a major advancement in modern gynecological surgery, offering safer, more effective, and patient-friendly treatment. Although its adoption in Sri Lanka is still growing, it is undoubtedly shaping the future of gynecological care. If you found this video informative, don't forget to like, share, and subscribe for more insights into gynecological procedures and laparoscopic surgery. Thank you for watching.